Peggy, would you like to bring up the slides? Hello, good afternoon, everyone, and thank you for joining us today. Next slide, please. Hi, everyone, again, and welcome to today's webinar. This is the Peer Support Approaches for Healthcare Providers webinar series, and this is session 1, colleagues involved in reaching colleagues through listening and empathy, also known as CIRCLE. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC, and we're housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy, and I'm the project coordinator of this center, and will be facilitating this webinar today. Next slide, please. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC Network website for additional information at mhttcnetwork.org. And if you're interested in staying up to date with the events and products the Northeast and Caribbean MHTTC is providing, we ask you to sign up to receive our email communications. You can sign up at the bit.ly link provided on the screen. Next slide, please. Next one, please. Following the webinar, we will ask you to complete a brief survey, and we value this feedback and use it to improve our activities and inform our future activities. These surveys are also important because our continued funding is linked to the completion of these surveys, so we thank you in advance for your feedback. Next slide, please. We also want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint slides in the next couple of days. Next slide. At the time of this presentation, Tom Codier was serving as Acting Assistant Secretary for Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions expressed in this presentation is intended or should be inferred. Next slide, please. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask some of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may pose questions to you, so we ask you to please use the chat feature to answer them. Next slide. The MHTTC network uses affirming, respectful, recovery-oriented language in all activities. This includes language that is strength-based and hopeful, that is inclusive, accepting of diverse cultures, genders, perspectives, and experiences, language that is healing-centered and trauma-responsive, language that invites individuals to participate in their own recovery journey, language that is person-first and free of labels, non-judgmental and avoids assumptions, and that is respectful, clear, and understandable and consistent with our actions, policies, and products. Next slide, please. We have Dr. Chantal Brazo, Dr. Ping Xin Chen, Dr. Manasa Ayala, and Dr. Peggy Swarbrick with us. Dr. Brazo has served over 25 years of experience in the field of health professional well-being. She has taught about well-being and burnout, conducted local and national survey-based studies on medical student, faculty, and physician well-being, and presented at national and international venues on these topics. As the inaugural Chief Wellness Officer at Rutgers Biomedical and Health Sciences, she works with school, university, and hospital leadership teams to explore and lead the development and implementation of wellness initiatives for faculty and healthcare providers. Dr. Chen is an experienced mixed methods researcher with extensive experience in intervention studies, community service learning programs, quality assurance and quality improvement projects, and clinical trials. Dr. Chen is proficient in building and managing secure online surveys and databases and using specialized statistical software packages for data analysis. She has provided quantitative and qualitative analysis and evaluations of several surveys on faculty and health professional well-being. Dr. Ayala completed a fellowship in medical education and has formal training in qualitative methodology and experience conducting large survey research. Her work exploring bullying and residency training was published in the Journal of the American Medical Association in 2019. She has experience in physician wellness intervention spanning from the learning continuum from the undergraduate medical education to faculty wellness, and currently serves as faculty vitality champion for the Department of Medicine and chair for the Department of Medicine Wellness Committee. Additionally, she has personal experience with engaging in informal peer support through a texting platform. Dr. Swarbrick has worked for over 35 years in a variety of healthcare settings, designing and evaluating innovative peer-delivered models and training programs that promote wellness and resilience. She has created an 8-dimensional wellness model adopted by behavioral healthcare agencies and state authorities across the country. In addition, she has developed a wellness coaching model and wellness self-care programs for a variety of populations, including health professionals. Dr. Swarbrick has published extensively on a wide range of topics, including health disparities, the wellness model, and health promotion approaches. So now I will turn it over to our presenters, and welcome again.
Good afternoon. Thank you for joining us. Since we've had such a kind introduction already, we're not going to repeat our names, but all of us are here today and looking forward to speak with you about how we utilize various platforms and virtual approaches to support a culture of well-being and peer support in our environment. So the objectives, next slide, are to describe how we developed a program of peer discussion groups using both synchronous and asynchronous modalities, really meaning virtual meeting platforms and text messaging to support physicians during the COVID-19 pandemic. We will describe the demographic characteristics of the physicians who chose to participate in each type of groups, and look at the impact of the group on the professional fulfillment or the meaning that physicians feel in their work or interpersonal disengagement before and after participation in those groups. And we hope that you could use this experience to develop or think of a similar program at your own institution. So we know very well that COVID-19 has had incredible negative emotional impact on physicians and healthcare providers, and really all of us in society have been impacted by COVID-19. Many healthcare providers and physicians actually experienced burnout even before COVID-19 happened. And we feel that this existing burnout, which affected about close to 50% of physicians, may increase vulnerability to the impact of COVID One more?
Yeah.
Okay. And so COVID could have made an existing situation worse. On the other hand, one of the silver linings is that COVID has increased attention to well-being of all healthcare professionals in really a way that was unprecedented. And we, through this increased attention, is how we were able to apply for funding to develop this program. So next slide. So we already know that through randomized clinical trials, that peer discussion groups of physicians about meaningful topics in medicine can actually reduce burnout. This was shown before COVID-19. So the question that we had, and we weren't exactly sure, is how would we conduct this peer support while being physically distant? Would web-based support platforms work for this?
Yeah, and while meeting with our school wellness champions, the idea of using texting actually came up as an informal form of support. Many faculty were already using the support, including myself. And we also found articles demonstrating how connected people can actually feel using text-based messaging. So we thought, can text-based messaging work for discussion groups? And we actually held focus groups with our faculty to ask these questions, and found that faculty showed interest in both virtual platforms and also text-based discussion groups. And then we proceeded with the grant application focused on this. Next slide. And then, of course, our peer talk and text groups were born from these ideas. We called these groups circle groups, colleagues involved in reaching colleagues through listening and empathy. And the intervention was created with a focus on service, and participants were enrolled for open enrollment. We did not randomize into talk or text groups. We wanted to study the characteristics of faculty who would choose talk versus text groups. We announced enrollment through different mediums, so email, a recruitment video, and presentations before leadership. Physicians were invited to self-select their groups with the goal of 5 to 8 faculty, and a group leader was assigned who registered the group. The program is designed as 6 months in duration with an assigned discussion topic every other week for the entirety of the 6-month period. And faculty met either by virtual synchronous meetings for 1 hour or by texting asynchronously on a secure platform. We used WhatsApp over the week following the release of an assigned topic. Both groups did receive 1 hour of CME per topic. Next slide. So groups started in September, and then the discussion groups, they were formed actually in September, and the discussion groups formally started in October, as you can see in this figure here. The last scheduled topic release was April 5th, and the program did complete April 16th. We developed our evaluation instrument in September, and there were planned survey starts at the start, the midpoint, and the end of the program. We also conducted focus groups with participating faculty at the conclusion of the program. Next slide.
So you're actually seeing a screenshot of our introduction video. And in the introduction video, we provided guidelines to all those who elected to participate as to how they should participate in their group. And so we talked about listening generously to your colleagues or reading texts attentively, depending if you're a talk or a text group, respectively. But either way, not being non-judgmental as to whatever you hear from your colleagues. Validating your colleagues, sharing your own experiences, but not attempting to fix. So this is not about giving solutions to your colleagues. It's more about sharing and listening attentively, and keeping all discussions strictly confidential. We also explained that it's okay not to respond right away. So in the case of talk groups, it's all right to have some silence. In the case of a text group, it's okay not to respond immediately. There sometimes there just needs to be time for reflection in discussions like this. So take the time that it needs to reflect. Be true to the topic. So there are prompts and topics every other week at each session, but then also allow flexibility. We instructed, folks to go where their thoughts led them and to trust the group process. While we had the same topic for every group, we knew that it may take a different direction in various groups depending on the experiences that the various group members may have. Next slide. This is an example of a prompt. Our topics are released, as we mentioned, every other week. Each topic is never more than 1 page long. And if you can go back. And so this was an example of a prompt that we released during fall. So right after the first surge of COVID in September of 2021, 2020, sorry. Time is flying so fast. We realized, that's when people were realizing that the kids would not go back to school. And so we thought this was a good time to release a topic about work-life integration. So we always have at the top of our topic, always a reminder of the rules of engagement, listening attentively, confidentiality and so on. And then there's typically a paragraph just like this. Integrating work and home responsibilities can be a challenge. This was true even before COVID-19. Now work-life integration seems even more challenging. And we use the word integration instead of balance because balance implies a trade-off, gaining of one side at the expense of another. Integration is how to creatively consider both sides. Then we follow with questions. And so those are questions for that work-life integration. What does good work-life integration look like or feel like for you? Can you share a time where you feel you had very good work-life integration? What made it work well for you? And finally, what pearl of wisdom can you give a colleague right now to help them find work-life integration during COVID-19? And following those questions then, which we ask the leader to initiate, then the group goes on and talks. At the end of the hour of a virtual meeting, or at the end of 1 week, for the talk groups, we tell them they should talk asynchronously for about a week following the release of the topic. Then they're done with their topic, and there's usually a little send-off message that's we're not showing on this slide that just sort of lets them know that the topic is over. So the next slide shows various prompts that we have used. So these represent questions for various topics. We had a topic about mindfulness. So one of the prompts was, have you ever practiced mindfulness, either as mindful moments or as formal meditation? If so, what was that like for you? We had a topic about appreciation. Have you received appreciation from colleagues? If so, what was it like? We had topics about professional fulfillment and an understanding of the barriers that can happen in the work environment and asked them to reflect about that. We had a topic on wellness strategies that they use in the face of difficult situations at work. And all of our prompts were in context of COVID-19. So we frequently had at least one question amongst the 3 questions that were asked that brought them back to the situation with COVID-19. What is the part of your work that gives you joy? Share a fulfilling encounter you had with a patient. How can we support each other when an error or adverse event occurs? This was a topic on medical errors. Next slide. So when we were setting out to develop the evaluation for this program, we really wanted to strike a balance between having a meaningful evaluation, but also really being brief and not to have a high survey burden on the participants. After all, this was to be supportive, not to add a burden. We also did not want this project to be perceived as a research project. We really wanted it to be viewed as a service to our profession, to our community. So we created a survey that was in the end 1.5 minutes long at most. It was anonymous. In order for us to be able to follow people, we asked for people to create their own anonymous identifier using those items that are listed on the slide. And then we selected some questions from the Professional Fulfillment Index, which is a validated instrument that looks at professional fulfillment in physicians. So we pulled particular questions about interpersonal disengagement, professional fulfillment, and meaning. And the reason why we pulled these, again, because we wanted to be very specific, we didn't want to have too many questions, but we knew from the literature, from that randomized clinical trial, that those were the areas that were the most impacted. So we wanted to see if we were going to impact them as well. We also had some demographic questions. We had some questions about whether talk or text was effective as a platform. And we wanted to understand who would choose what, meaning, what in terms of demographics of our faculty, who would be more likely to choose text or talk. Next slide.
So 50 physicians chose to participate, forming a total of 8 groups. And looking at general demographics of the physicians who chose to participate, you can see here that 20% identified as men and 80% as women. Next slide. Also, our physician participants reflect the diversity of the faculty at our institution, with the self-reported race ethnicity breakdown as noted here. Next slide. And we noticed that most of our faculty were a junior at the assistant professor level who chose to participate in circle groups. Next slide. Looking at who selected talk versus text, you can see here that text groups were selected as an option more often by our male participants, and this was statistically significant. Next slide. Text groups were more popular with our more junior faculty, and talk groups were more often selected by our senior faculty. This was also statistically significant. Next slide.
Now we come to the findings. We compared professional fulfillment and interpersonal disengagement among physicians over time. The 3 lines on left of the chart show the changes between initial and post surveys for all participants. The average score for work is meaningful, shown as the red line on left, increased from 2.9 at pre-test to 3 at post-test. The mean professional fulfillment score, shown as the green line, increased from 2 at the pre-test to 2.2 to the post-test. There was a trend of improvement in professional fulfillment over time, although not statistically significant. The blue line in the lower chart indicates that the average score for interpersonal disengagement decreased from 1 to 0.6. So here is our important finding. Compared to the pretest, physicians were significantly less likely to have interpersonal disengagement with patients at the post-test. We also conducted subgroup analysis of talk and text groups. Results showed similar trends of improvement in professional fulfillment and reduction in interpersonal disengagement over time. Next slide. At the post-program evaluation, about 74% of participants shown in purple on left side of the chart thought that it was very or completely true that the program was effective in engaging with participants' group. 77% shown in purple on right side of the chart would recommend this program to a colleague. There was no significant difference between the talk and text groups in respect to effectiveness in engaging with their group or being recommended to others. If we included those who said moderately, completely, and very true, 82% of participants thought that the program was effective in engaging with participants' group, and 90% of participants would recommend this program to a colleague. Next slide.
So yes, so we, in addition to gathering the information that we did by these surveys, we also did organized a series of focus groups after the program to gather some qualitative data from the participants. And so the team worked together to kind of coordinate these focus groups. We did them, of course, via Zoom, and participants shared their experiences. Particularly, we asked questions around the meaningfulness of the experience being in either the talk or the text group, the effect on their general overall well-being, and the convenience, kind of looking at we were wanting to see, the two different types of choices that people opted for, whether it was the text or the talk, what were people's experiences in general, and also to look. So we use a constant comparative method, and we're currently still underway. So we're providing you now some preliminary feedback of our qualitative component of this project. So in terms of the next slide, some of our initial focus group findings is that in terms of the most meaningful aspects of the groups, really was powerful that the sentiments that people shared around the deeper and more personal connection with peers that they felt. It was really powerful to hear that this opportunity, whether in text or talking together or meeting intentionally, having these dialogues, really helped people to get this deeper connection with other peers, fellow peers, and really more that personal connection. And another piece related to that, which was really strong, was feeling that they were not alone. And especially this was such an important piece. And even in the text connections, people reporting that they're able to not feel alone at this point of, especially the disconnect that we were having at that period of time. People were really having a lot of that isolation, and it helped them with that connection and feel not alone. So that was one of the most meaningful so far, what we're seeing in terms of the data so far. In terms of the text format seemed to appeal to those who felt that their work schedule and families responsibilities precluded them from finding a unique time. So of course, that time management factor. So the text really provided that flexibility for people to do it when they want, to not have to have a preset time. And the people who tended to choose for the a virtual synchronous format, it really was people were reporting things related to like having that conversation in real time. And they also, in terms of that, it was flexible, but again, there was just definitely these, it seemed very clear that it was powerful for each of the groups, but for the preferences in terms of what was for individuals' preferences, is each of the formats seems to have a particularly met their need in a specific way. In terms of some of the representative quotes on the next slide to share, just to give you a little bit of a sampling on the next slide, one of the participants said, "We are much more closer to each other now that we can sometimes sit and just share our problems and talk to each other if need be." This was, a talk group participant. So that closeness, connection, and that sharing, again, of that with a peer was really important to this, the participants. Another participant said, it was really just about us, support, about us, like focusing on them as themselves, which was, I think, has so impacted for people in supporting one another. So I think that was the most meaningful part of this participation in the for this participant was the talk participant. And someone else who was a text group participant shared, it actually felt like something you look forward to, of just trying to connect with each other and see, how everyone was doing, so that, supporting of each other, connecting, being there, and that feeling of alone, it provided that connection. So those were a couple of the illustrative quotes for that particular question relating to meaningfulness. Now Ping will share a little bit more and others will share some other pieces of our preliminary analysis of the qualitative data. Next slide.
So Dr. Swarbrick mentioned about realizing not alone as one of the preliminary themes. So here are some quotes from the participants. The first one from talk group, here she mentioned that she was not feeling alone. She was not the only one who had a hard time. And the second one, second quote was from a text group participant, basically saying that during the group time, they shared experience. They had people who had similar experiences. Number three, the quote from a talk group participant, the participant said that it was so helpful, almost therapeutic at times. So the time getting together, either through in-person sessions or meet virtually, really helped them to have the feeling of being together. Next slide.
Another preliminary theme that was also mentioned by Dr. Swarbrick about thinking about the options of synchronous or asynchronous platforms to improve engagement. So, a text group participant had said, you could just watch it whenever you had the free time, see what other people say, and at your own time, be able to type in your own response. Another text group participant also said, it helped me a lot because I tend to have my schedule packed during the day with rounds, patient care, and everything. So being able to unwind in the evening with that made it better fun. Next slide.
So you've had a lot of, you can see how it was being received. The groups were pretty much self-sufficient, right? They were self-facilitated. So we were really curious as the groups were evolving as to how they were being accepted, how they were progressing. So we planned a meeting with the circle group leaders after the second topic had been distributed, and then also at the middle around the sixth topic. And so what we found from the circle group leaders, the vast majority were participating. The vast majority of participants were claiming their CME. For those who were clinicians, we were getting CME for that. And one of the first comments that we heard from the leaders that really, I think, made us feel good about the work about this work that we were doing, they were saying things like, here were people in our group, we had worked with each other for years and we never got to know them as well as we're getting to know them now with this group. And that was very powerful. And it really touched my heart when I heard that.
Yeah, I know we also had a lot of leaders who had different techniques for engagement. So one leader shared with us that he had arranged for one of the group members to be a secondary leader who would make sure to keep the discussion energized and was a really great strategy. And he shared this with other leaders in our kind of discussions. And so other people had the chance to try that as well. We actually also learned that one group started out as a text group, and then they had switched to a talk group because they felt that the conversation hadn't started. But once they had seen each other, very interestingly, they were actually able to become a hybrid group. So they were talking and they were texting. And so if someone could not join the video, they would text the group while the other group members were talking. And we thought that was also very fascinating.
Mm-hmm. One of the other issues as well, comments that we thought were very interesting is, as overwhelmed as people were feeling, especially with COVID, what we were hearing from our leaders is that the group meetings kept going, even if they felt overwhelmed. It was something that they looked forward to and that they made sure to make time for it during the course of the day. So that was very meaningful. We had one group who was somewhat less connected than others. This was originally a text group, No, I'm sorry, it was originally a talk group and they couldn't get together, couldn't find time where their schedules meshed. And so they switched to a text group and then never really got going in a satisfactory way where everybody was participating. The engagement was not as strong. In the course of debriefing with the members of that group, what we found is that when they couldn't meet the first time, they switched over to text, they switched over to the second topic right away without doing the first topic. The first topic included an icebreaker, sort of a bonding activity. And we were hypothesizing that maybe that's why they didn't bond as well, because they didn't have a chance to do that. What the activity was is that everybody was supposed to share with the group something that the group might not know about them, even though they may work side by side every day. You know, what things might they not know about that person? And in speaking to members of that group in focus groups later on, some members did say, you know, they felt that if they had had that icebreaker, it might have made a difference to them. But we'll never know for sure. But that for sure going forward, one of the lessons that we learned is to make sure that there is always a bonding activity that happens at the beginning and that everybody participates in it. Other interesting things we learned from our leaders, people were sharing pictures, either whether they were doing a virtual Zoom or whether they were doing by text, they were sharing pictures of their kids, they were sharing pictures, they were sending little memes or humorous types of quotes to each other to supplement the talks that they were having. And there was a lot of humor and fun in the process, along with the topics that we had. So that was interesting that we learned that from the leaders. Next slide.
So our key takeaway points are that peer discussion groups conducted synchronously with web-based platforms and asynchronously using text-based platforms are a viable and feasible alternative to face-to-face groups. And then interpersonal disengagement was significantly reduced after participation in the circle text and talk groups.
And the most meaningful aspects of our groups were the deeper and more personal connection with peers and the realization that they were not alone. Future direction, we're continuing these groups as we speak with residents. We plan to engage more health professionals. We just announced a second series of the circle groups with our faculty, and about half of our participants have already registered to continue, and new groups are forming who have not participated before. So we're very pleased with how things are going. And then the last slide is again our team members and our contact information. So if you want to show the last slide so that you can see how you can reach us if you have any questions at all about this program. We want to acknowledge funding by the Healthcare Foundation of New Jersey and support from our medical schools, Rutgers, New Jersey Medical School, Robert Wood Johnson Medical School, and University Behavioral Healthcare, who were all supportive of this program at the time that we were doing this first series. So we want to thank you very much for your attention and happy to take questions.
Yeah, if anyone has questions about the how the process, and also this is also part of a larger another program which we'll be presenting about next week, which is another program that's part of this. But if anyone in the chat, please put your question or comments. We'd love to just answer. A couple people felt it was fascinating, and we're going to follow up already. We have one person mentioned that already, someone. But if anyone else has, just love to hear what your feelings are, and just maybe what you think about applying some of these strategies in your settings, those of you who are here.
Thank you so much. So at this time, again, we invite you to share your comments or questions. You can either share them in the chat, or if you'd like to share them in the Q&A pod. Any questions that you have for our presenters? So while folks are gathering their questions, I'm just going to also share that we have a evaluation component. If you have a QR code reader, you can access our evaluation survey by using the QR code. Also, I will share the link to our evaluation survey in a follow-up email.
Yeah.
We do have a couple of questions.
Yeah.
That's wonderful. So we have someone asking, do you have resources available such as the weekly prompts that can be shared, or has this been published?
Who wants to take this one?
Yeah, Dr. Yeah.
So, the prompts have been published in that randomized clinical trial, and the groups. It was published by Colin West, W-E-S-T, who's a faculty at Mayo Clinic, and these topics are published in that randomized clinical trial, which we can also send you the citation if you want afterwards to look it up. Separately from that, we are putting our prompts on a website for groups to have access to the group to have access to the prompts, so that they what we're looking for eventually is to be in a system where the groups can be a little bit more independent and can access the different prompts and choose the prompt that they want to talk about at whatever meeting or whenever they're scheduled to meet. So that's another way that we're disseminating the prompts.
Thank you so much. We have another question in the Q&A pod. Did the group interactions ever need redirection away from more negative reinforcing, such as griping or complaining?
Well, I mean, it's hard to know that for sure in a sense, because we weren't like in the groups, but I'll just answer mine, and the other from the focus group feedback, and just being part of the process. My sense is that that this was an opportunity to vent, and I think that was something that we did here. But I think it sounded like there was like a constructive venting. I think, when you use the peer support principles verily in action, it helps people in a way to vent in a way that's a safe space, but it helps people to then move to some of the, to not get stuck. So I'm thinking, I think others can talk a little bit about that, but my takeaway was that there was definitely probably a lot of venting and a lot of negativity shared at the time, but I think it helped to create a safe space for it and helped to transform it into something that was more like resilience building for people. But
yeah, I think I would agree with that. I think that some of our groups were really, they made a point to say that they were really, amazed that everyone was going through this, or their group had very similar experiences. So even though maybe it started off as a venting and maybe there was some negativity, it actually ended on a positive note, and people were really able to take away sort of life hacks or life skills and share that with each other. And there were some real kind of sustained measures. I don't know if this was mentioned, but one of our groups had started like a Peloton movement where everyone in their group ended up getting a Peloton because they were all so inspired to exercise. And so they kept sharing that with us. That was really also very interesting.
Yeah, it prompted people to and it was part of some of the strategic prompts to help people to think about what you would do. I think the prompts also help to shape a positive action, even regardless of it was a way to ventilate, but it helped the people to move to a positive action.
And not all the topics were positive, and that was intentional. Some of the topics, had to do with medical errors. Some of the topics talked about, how do you express burnout or compassion fatigue or moral distress, and how that has affected you. But we didn't shy away from difficult topics, and at the same time we were careful. If there was a question in the prompts that could lead to the expression of difficult or challenging issues, we always had prompts as well that encouraged, the development of coping so that it could be balanced. I think it's important to talk about all of these topics, whether they're quote positive or challenging.
Thank you so much. So at this time, I don't see any other questions either in the chat box or the Q&A pod.
I did note that some some people who did put in a few things in the chat are people who do peer support work, who noted that this was really on spot, as he said, and, resonated well with doing the work as peer supporters. And it's like, it seems like a model that, as a peer supporter, it's just such so hopefully everybody will think about some ideas to bring to your work as peer supporters. Yeah. And if there's anything we could do to help, reach out.
But it's important to also make the difference, right? Those are circle groups.
Mm-hmm.
None of the people in those groups had been formally trained in peer support techniques. We have a separate program where we are actually training people in the formal peer support techniques to do one-to-one. There is, the principles of listening carefully and generously and not trying to fix somebody so that they can come to their own solution as part of, sharing their experiences. Those principles are the same, but we didn't train anybody in these groups as a peer supporter. We simply gave them the instructions that we shared with you before. One of the participants in the focus groups, actually more than one, really appreciated that we had that little paragraph at the top of each prompt where we reiterated those rules of engagement, and particularly the fact that those groups are confidential. She said it was so important to her to know every time people were being reminded, this is confidential, this is confidential. But they were essentially self-facilitated groups and with those very, very basic principles. So what's good about that is that, many people can benefit with simple instructions. It can be disseminated possibly a little bit more than doing formal peer support training, which is a little bit more, takes longer to do and a little bit more difficult. So both programs have their place and are complementary.
Thank you, Dr. Brazo. And I would agree that, and reinforcing the confidentiality is very important in creating those safe spaces for sharing. Let's see, any more questions? No, I don't see any more questions in the chat. Do you have any maybe questions that you'd like to pose to our participants?
I'd like to just mention, when you think about the name of the group, as we started off the presentation, it's the circle groups, colleagues involved in reaching colleagues through listening and empathy. So as been mentioning, I think those are the key ingredients of in the work that makes this so powerful. And I think things to think about as you think about taking away, that connection, which we heard was so strong. And then that listening and empathy was a really important piece that really created the circle.
Thank you. And I just wanted to also go back a little bit in the presentation to share the contact information for your team in case anyone had any questions. Let's see. Okay, so moving along here, I also wanted to share that we are also conducting a needs assessment survey for behavioral healthcare providers. I will also share this link in our follow-up email following this presentation. You can also access the needs assessment survey by scanning the QR code that you see on your screen. And then also as a reminder, this webinar is being recorded It will be posted to our website within a week. Everyone who participated today will also receive a certificate of participation. And we will share a link to the slides once they are uploaded onto our website. And then lastly, if you have any questions regarding our training events and programs, you can contact us here at Northeast Caribbean at mhttcnetwork.org. And also be sure to follow us on social media. I will also share the link to our newsletter and our email listserv in the follow-up email that I will send out so that everyone is also kept up to date. We do have another webinar next week. Now, your registration for today also registers you automatically for all of the sessions, should you choose to attend, but you will still have the link in your inbox. And thank you so much for your comments. Thank you for your positive encouragement. Thank you. A big thank you to our presenters, Dr. Brazo, Dr. Chen, and Dr. Ayala, and of course, Dr. Swarbrick for joining us today and providing this webinar for us. We hope you have a wonderful rest of your day, and we will see you next week.